In this video, I'm going to show you 3 things that you can do to get rid of pain in your knee. When it comes to our knees, we have a lot going on. We have muscles and tendons and ligaments and fascia that all are a part of that joint. The important thing you need to know about knees and knee pain, it's possible that your pain in your knees is coming from your feet and your hips. But today, we're actually going to talk about reducing the pain in your knee. And the tool that I love to use, and I rarely leave home without, is a ball. This is a lacrosse ball. It is pretty intense. If its intensity is too much for you, you can use a tennis ball. Try out different things. When I use a lacrosse ball for pain relief, my intention is to work on fascial tissue. Our fascia is connected from our foot all the way up. And the reason I'm telling you about that and about fascia is because this work is meant to work on your fascia. It's kind of like a pin and stretch. We're working with the fascia, we're working with the nervous system. We're working to release that fascial tissue so that things can move more smoothly as they're meant to do. And the important thing about that, moving while doing this work needs to happen slowly because our bodies actually respond when we stretch too fast, and it responds in a way to stop you from that stretch so that you don't overstretch. So the slow movement, you're reaching, you're pulling, you're not yanking, is really important. Now, I mentioned all the muscles and fascia and all the connective tissue that affects our knees. Much of it is in our upper leg and in the lower leg. That's where we're going to focus our pin using that lacrosse ball. Set yourself up so that you can, standing upright, have your leg on a stool or a chair. It could be a padded chair, although not too much padding, like a bed won't work. I've just padded this stool with a sweatshirt. So if you're out and about and you don't have a pad, you can just use a sweatshirt or a sweater that's balled up or something, just to protect the shin. I'm going to take my lacrosse ball and I'm going to put it right on the calf, and then I'm going to sink in and I'm going to feel what's going on there. Feel what's happening under that lacrosse ball. And when you find a spot, there's a spot. You'll know it. Your body goes, oh, hello. When you feel that spot, just stay there. You can push in a little bit. It should be intense, but don't push in too much. The movement you're going to do, flex and point your foot. So point and flex. And you'll feel the muscle working underneath there. You may feel the fascia all the way from the bottom of your foot going up and into the knee. Then take that foot and make one big circle, as big as you can with your toes, and then take it in the other direction, and then stop. And remember, as I said, slow movement. I would like to take this moment to make a disclaimer. What I say here is not diagnosing, it's not treating. If you do have an injury in your knee, go see your doctor. Usually, if somebody is cleared to do PT for their knee, then you can do this work. What I say here does not replace professional medical treatment. Feel, after you do it, feel what's the difference. I still feel where I was pressing down. That's okay. But the leg feels different. And that's key. Another way to use the lacrosse ball, put it underneath your calf and allow that leg to press down and in. And I'm going to actually first, so I'm not foam rolling. I'm not going back and forth on that lacrosse ball. That's kind of just mashing the tissues. It's not making any significant change. If you find a spot, and I just moved it around a little bit to find the spot, and there it is, because I can feel that intensity. To get it to be a little more intense, I'm going to take this leg and I'm going to press down on the top and get some, I'm pinning that tissue with the lacrosse ball. Then I'm going to flex that bottom foot. Oh, and there it is. And flex and point, and I can do those circles again. I'm going to find another spot, and I'm going to press down with my heel or my foot, and I'm going to move that. Flex and point, nice and slow. Make a big circle around. And again, just for 20 seconds, not a long time. That change will happen. Sometimes I use a softball. We just did some work on the lower calf to affect the knee. Other muscles that can affect the knee and other areas where we have fascia, that tightness that can affect the knee, is in the medial thigh, these muscles and this whole line along here, or the lateral part, or the hamstring, or actually the quads in front. I'm going to pick the hamstring and I'm going to use the softball. Take your ball, put it under that hamstring. Lean in a little bit and find where the intensity is. Move it around. This is best done on a stool where you can sort of swing your leg back and forth, or a table, but you want it to be sturdy because you don't want it to tip over. I'm leaning forward onto that leg so that I'm pinning that tissue, and I'm also going to pull up on this stool. I have a nice sturdy stool and I can pull up, and that makes for more intensity. Flex your foot, keep it flexed while you raise and straighten the knee, and then bend the knee and straighten the knee. Keep that foot flexed. It's more powerful that way. Once you get up here, you can also internally rotate at the hip or externally, both, back and forth. Remember, just go nice and slow. So back and forth as you straighten your knee. Push that heel out. You can feel that lengthening all along the back line. I'm placing the ball under my leg to pin that hamstring. I'm going to find a spot without falling off. Oh, there's a spot. All right. If you don't find a spot, then you don't have an issue, maybe. Lean in, and you'll notice I'm going to pull up on the stool so that I can get more intensity on that. And then I need to lean backward so that I can get my knee straight. Flexing my foot towards my face, and then pushing that heel towards that wall as I straighten the knee. And I'm pulling up. You can make it a whole body movement. I'm sitting upright, and then I'm going down like that. As I lift that knee up, and then I can do a little bit of internal, external rotation, sort of rocking the heel side to side. I have one more area that I want to show you, and I'm going to use a super ball. I use a super ball because it's a little bit smushy. It's hard, but it's not as hard as a golf ball, which might be difficult in this area, because we're going to look at the lower calf again, only the front part of your calf. So we're going to look at right alongside the shin, not on the shin, but alongside the shin and that muscle. If you put your hand on the shin, right, just lightly even, and flex your foot up, you'll feel that muscle that's next to it contract. We're going to go for that area. I'm placing it along the side of that shin. Now I'm leaning in, and to make it even more intense, I can come down on it like that. Flex and point. Oh, flex and point and flex. And then you can, if you think there are more spots there, oh, that's a really good spot. Flex and point, and let's make a circle. And a circle that way. And those are the 3 things that you can do to reduce pain in your knee. When I remember to do these things, I can walk further distances. The stairs don't give me trouble. I don't have aching in my knee, and I don't have swelling in my knee. One final thing after you do this, take a nice strong walk, because you've made change in the tissues in your body, and your body needs to integrate that into your whole body movement. I'm Ellie. I appreciate you. Please subscribe for more things that you can do for self-care of you. Remember, it's your body. It's your health. Take charge of it.